I'm Charles Bankhead of MedPage Today. I'm at the Society of Gynecologic Oncologists meeting in Tampa, where Dr. Jason Wright of Columbia University in New York presented findings from a study suggesting a possible biological basis for racial disparities in outcomes of endometrial cancer. Dr. Wright, could you tell us a bit about the background of this study?
Sure, absolutely. Our study is basically an epidemiology study examining racial disparities in endometrial cancer, and it's long been known that African American women with endometrial cancer have a worse survival than white women with endometrial cancer. So the goal of our study was to look at a large group of women with endometrial cancer and see if that survival difference has persisted over the last 15 years and try to analyze factors that may be responsible for that survival difference.
And what was your principal finding in this study?
Two principal findings. The first is that the decreased survival for African American women has persisted over the last 15 years. So even in 2004, an African American woman with endometrial cancer tends to have a worse survival than a Caucasian woman. The second major finding from the study is that there tends to be a difference in the type of tumors that African American women have compared to Caucasian women. But even when adjusting for that, it doesn't completely explain the survival difference that we're seeing. So what that suggests to us is there's probably some intrinsic difference in the tumors in African American women that's causing them to have this worse survival.
Is there any evidence in the literature to support that view?
There have been some molecular biology studies looking at different oncogenes and tumor suppressor genes. And those studies have found that there do appear to be some differences at the molecular level between the cancers seen in white women and those seen in black women.
How do you hope this information can be used?
I think a major goal of this is just to get the message out that there's a lot more work that needs to be done for endometrial cancer in African American women. These women are at high risk of dying from their tumors, and we need to really find strategies to better treat these women. Kind of the second goal, the second major thing that our study will lead to, hopefully, is further work to, again, look at and identify the intrinsic biologic differences in these tumors.
Thank you very much.
Sure. Thank you.
Another study reported at the SGO meeting provided additional evidence of a possible biological basis for racial disparities in outcomes of endometrial cancer. Data from a gynecologic oncology group clinical trial showed that African American women with early-stage endometrial cancer had more than an 11-fold increased risk of recurrence and a 2 to 3-fold increased risk of dying compared with white women with early-stage endometrial cancer. The differences persisted after controlling for multiple confounding factors. For MedPage Today, I'm Charles Bankhead.